Discussion. Favor will be performing a urinalysis procedure using the Combi 11 reagent strip. This procedure is a routine laboratory test that helps in detecting abnormalities in the urine. What is the purpose of the procedure? The purpose of this procedure is to perform a rapid screening and diagnostic test to help detect and monitor urinary tract infections known as UTIs, renal diseases, metabolic disorders such as diabetes mellitus and liver disease. What are the materials required? Combi 11 urine reagent strip, clean, dry urine collection container, timer or stopwatch, gloves and protective wear, lab coat, mask, etc., tissue or absorbent paper, color chart from the Combi 11 strip container, a well-lit area for reading color changes. What does the Combi 11 strip tests in urinalysis? The Combi 11 strip is designed to test for 11 parameters in the urine, namely specific gravity, pH, leukocytes, nitrites, protein, glucose, ketone, urobilinogen, bilirubin, blood, and ascorbic acid. What sample is needed? The required sample is freshly voided midstream urine, preferably the first one in urine because it is the most concentrated. Ms. Favor will have to collect 10 to 15 milliliters of urine in a clean, dry, and properly labeled container. Favor should test the sample within 1 hour of collection. If delay occurs, refrigerate at 2 to 8 degrees Celsius and bring back to room temperature before testing.
Hello, good morning. How are you today? My name is Favor. I'll be attending to you for your urinalysis today. This test helps us check your urine for any signs of infection or other health conditions, such as problems with your kidneys, liver, or even diabetes. It gives the doctor important information about what's happening in your body, sometimes even before you notice any symptoms. Here's what you'll do, Ma. I'll give you a clean, labeled container. Please clean your private area with the wipes we'll provide before collecting the sample. When you start urinating, let the first small part go into the toilet. Then collect the middle portion into the container, just up to the line. When you finish, close the lid tightly and return the container to me or the lab staff.
First, mix the urine sample gently. Do not shake vigorously. Secondly, remove one Combi 11 strip from the container and close the lid immediately to prevent moisture exposure. Thirdly, immerse the strip completely in the urine for about 1 second. Fourthly, remove immediately, dragging the edge of the strip along the rim of the container to remove excess urine. Fifth, you should touch the edge, side, of the test strip lightly against a clean, absorbent tissue. This removes extra drops of urine that might otherwise run between test pads and mix the chemicals. Do not wipe the strip across the tissue. Wiping could smear or damage the test pads and give false results. Purpose is to ensure the correct amount of urine stays on each test pad for accurate color development. Sixth, hold the strip horizontally to prevent reagent mixing between pads. Seventh, read results at the specific time intervals indicated, usually between 30 seconds and 2 minutes, depending on parameter. Eighth, compare color changes to the color chart provided on the container label, under good lighting. Finally, record findings accurately in the patient's chart or lab record. Combi level reagent strip is a quick and reliable diagnostic tool used in routine urinalysis to detect multiple biochemical substances in urine. It provides vital clues about kidney function, liver health, urinary tract infections, or other metabolic or systemic disorders. Each colored pad on the strip changes according to the presence or concentration of a specific substance. The presence of leukocytes could mean inflammation or infection in the urinary tract, commonly seen in urinary tract infections. White blood cells in urine show the body is fighting an infection. The presence of nitrite could mean bacterial infection, especially by gram-negative bacteria, such as E. coli, which convert nitrate to nitrite. A positive nitrite test often supports the diagnosis of a urinary tract infection. The presence of urobilinogen could indicate liver disease or excessive breakdown of red blood cells. Very low or absent levels may suggest bile duct obstruction. The presence of protein could mean kidney disease, hypertension, or urinary tract inflammation. Normally, only trace amounts are present, so persistent proteinuria is significant. The urine pH can also provide clues. Normal pH ranges from 4.5 to 8.0. Highly acidic urine may result from acidosis, fever, or dehydration, while alkaline urine could point to infection or a vegetarian diet. The presence of blood or hemoglobin could mean infection, kidney stones, trauma, or hemolysis. Blood in urine always requires further evaluation. Changes in specific gravity reflects the kidney's concentrating ability. High values suggest dehydration, while low values may indicate dilute urine or renal dysfunction. The presence of ketones could mean increased fat metabolism, as seen in diabetes mellitus, starvation, or prolonged fasting when the body uses fat instead of glucose for energy. The presence of bilirubin could indicate liver disease or bile duct obstruction. Normally, bilirubin is absent from urine. The presence of glucose could mean diabetes mellitus or a renal tubular defect in glucose reabsorption. Glucose appears when blood levels exceed the kidney's reabsorptive capacity. Finally, the presence of ascorbic acid or vitamin C could interfere with the detection of other parameters like blood, nitrite, or glucose. Checking for it ensures accurate interpretation of results.